In the early 1960s, science and technology revolutionized the way we saw our world. The first human orbited the Earth, Watson and Crick received the Nobel Prize for DNA, and St. Jude Children's Research Hospital opened its doors. At the helm of this pioneering new institution was Dr. Donald Pinkel, a 34-year-old pediatrician from Buffalo, who was tasked with being St. Jude's first medical director.
On October 28, 1961, on the Feast of St. Jude, I arrived at St. Jude Children's Research Hospital, and the hospital was under construction. They strung 2 wires from my office to a nearby utility pole, one for a telephone and one for electricity. I was the first employee.
Pinkel faced many challenges. Bench to bedside was unheard of. There wasn't a successful blueprint for combining clinical care with research. And the prevailing attitudes at the time believed that childhood cancers were incurable, that even studying the diseases would be a waste of time. But Pinkel was committed to a mission of hope.
I refused to use the term hopeless. St. Jude was the patron of hope. And then you use your science and your medicine and your imagination to determine how you can cure these children or prevent the diseases, which would be the optimal solution.
Before St. Jude and Dr. Pinkel, only 4% of children with acute lymphoblastic leukemia were surviving. The standard therapies prescribed one drug after another, trying to suppress the disease and prolong life as much as possible. Pinkel's approach was to eradicate the disease. Called total therapy, he combined multiple drugs and multiple forms of treatment to aggressively kill off all leukemia cells in the body. It worked.
What happened was we learned how to combine drugs. We used radiation, all kinds of elements there, and we were able to put it all together and come up with a cure rate, and that was what we were looking for.
Never before had leukemia patients been successfully taken off therapy and survived. By Total Therapy 5, 50% of Pinkel's patients were considered cured. The medical community was shocked. At first, Pinkel was mocked for his audacity to even suggest a cure, but his data proved indisputable. Soon, other hospitals across the country began adapting Pinkel's protocol. Pinkel himself even traveled to the Soviet Union to help train researchers and clinicians. Total therapy became the standard of care, and Pinkel earned national and international acclaim. The Albert Lasker Award for Clinical Medical Research, the Charles F. Kettering Prize for Cancer Research, the Royal College of Pediatrics Windermere Lectureship, and many more. Today, at St. Jude, total therapy is in its 17th iteration, and our cure rate for ALL is more than 94%. We are able to shift our focus from cure to quality of life for our patients, and our survivorship clinic is growing exponentially.
When I think about the advances in science and technology today, the potential for improving child health is fantastic. And all we need to do is continue our work as at St. Jude to materialize those advantages and improve the health of children all over the world, regardless of where they are or what their ethnicity or economic status is.
From that small, unfinished office with bare electrical wires, Pinkel laid the groundwork for an ever-expanding, world-class institution and a beacon of hope for the most hopeless of cases. His legacy inspires all of us to continue the mission he helped build, to rebel against conventional wisdoms, to innovate new means of treatment and discovery, and never stop fighting until no child dies in the dawn of life.